Stress Response and Stress Management, Chapter 10. These are the terms you need to be familiar with and be able to recognize, describe, and eventually be able to help a patient utilize as you become more of an expert on utilizing some of these techniques. So our first objective is to identify the long-term and short-term consequences of physiological impact of stress has on a body. Okay, be able to recognize Cannon's flight and fight response and Sly's gas response of stress, and also describe responses of stress and mediating perception, personality, social support, cultural, and spirituality. So let's get started here. Maggie's a college student and she's experiencing some stress in her life, and she says, I don't know what to do. She says, this is supposed to be this awesome, exciting time in my life. I'm finally going to college. I love college. I love being a student. But honestly, trying to juggle my schoolwork, job responsibilities, a single parent, it's starting to make me feel pulled in a million directions all at once. Some of you guys may be able to really relate to this. So we have what we call early stress response theorists, okay? We have Walter Cannon, who has the theory about fight or flight response. You guys have probably talked about this in Foundations. This is where your body prepares for a situation that an individual perceives as a threat. Like your sympathetic nervous system kicks in, right? Your autonomic nervous system. And the sympathetic kicks in, and new research indicates a few things that happen. That men and women have different neurological responses. Well, what a surprise. We actually know this, okay? So what happens when that body kicks in? And you can see, of course, those responses on page 158. You can see the response that takes place, the short-term effects, of course, that happen to be the hypothalamus and the pituitary adrenaline kicks in. You start to lose your fluids. Your glucose levels go up because you need a response. Your inflammation goes down. Your brain norepinephrine decreases because we're kicking all this activates. Your epinephrine levels go up, or your adrenaline, another way of saying that. Your heart rate increases, your respiration goes up, your plasma levels, your sugar levels go up, your triglycerides go up, your platelets go up, your kidney clearance goes down, your blood skeletal muscles and your muscle your blood levels into your muscles go up, and your muscular tension goes up. So this is all that short-term response that initially happens, right? Okay, so that's the short-term effects that happen. So why do we have a difference between men and women? Again, it's that testosterone and that estrogen effect that takes place, okay? And so the estrogen regulates our response and our limbic activity, our emotional response. Where men, that testosterone component changes, that prefrontal blood flow happens, and it increases our the cortisol levels of salivation in a man. It makes our responses different in our autonomic nervous system. And so our responses take place and occur differently. So one of the things that happen then in fight or flight is we look at things on a short-term basis of what it does to our body. But what happens if your fight and flight response has to continue? It doesn't get to shut off. The stress continues to keep occurring, okay? And this is where our two other points I want to make on the three stages in the exhausted phase. I want to point out that females have a tendency to befriend or tend to the exhausted phase. So females have a tendency to typically, instead of fight and flight, we kind of nurture or hold on to, and we're a little bit more resilient in that exhausted phase, um, a little bit longer than a male tends to do. This has a tendency because of the peptide hormones in the hypothalamus that we're able to do this a little bit longer. And so we don't deplete our reserves as quickly as a male may do so. So just to give you a little bit of an idea, but in the exhausted phase, the cortisol levels are going to increase, and as the cortisol levels exhaust and deplete out, this is where we're going to see depression set in, and that's how the cortisol and depression levels coexist with each other in the sense of their correlation. Okay. All right, on to the next slide. Okay, so Maggie, our college student, is aware that she needs help. On 3 afternoons a week before she starts class, she has lunch with her 2-year-old daughter on campus and then goes to yoga class right on campus. That also provides childcare. After yoga, her sister picks up her daughter and Maggie goes to class. I'm trying, Maggie says. It's still not easy, and I still feel a bit overloaded, but at least making some difference. It's a start. It's a step. Which stage of gas is Maggie most likely experiencing? Alarm, resistance, exhaustion, none of the above. If you picked B, resistance, that's exactly where she's at. She's working on adapting, okay? She's during this time she's sustaining. She's at optimal resistance, okay? She's not to the point of being exhausted, okay? The stressors are there, but she's overcoming them, and she's working on recovering and repairing and renewing. So these are the things that she's doing and she's trying to reduce the defenses and adapt her energy, okay, and keep herself in a state of, but she's still in a state of arousal, and she's still experiencing a little bit of exhaustion, but it's not severe, and so she's in a resistance phase, okay. So, but the stress is still there, and she's not in an alarm, fight, and flight stage. Okay. Bad stress versus good stress. I've already kind of explained this. Negative and draining, depressed, fatigue, stressors, loses, demands, and worries. For you, stress is energizing, motivating, results in happiness and joy, purposeful movement, uplifting. Okay. So, serotonin synthesis is created through more active, may impair serotonin receptor sites, brain ability to use serotonin. So, stress responses. So, chronic, one of the things that happens when you have chronic stress, it depletes you of your serotonin. In order to repair, you have to have downtime. You have to rest. So if you're always on the go, you're always doing, and you think that is good for you, it is not. You must have downtime. You must have recuperation time. So that type A personality, that's go, 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 you're eventually going to have burnout. You have to let your body have some downtime so your body can repair, your brain can repair, and get its ability to have its serotonin and the receptor sites improve, and continue to work. And exercise, of course, is one of those wonderful ways to help build your serotonin, because it builds your endorphins, and your endorphins help push your serotonin levels up. Now, there's interactions between your nervous system, your immune system, and during your alarm and gas phase. And it can have, of course, negative effects on your body to and produce protective factors. So, what are we talking about? Okay, so cytokines stimulate further release of your corticosteroids, and it inhibits your immune system, and it causes your system's inflammatory responses. Okay, so your cytokines are also part of what gets activated when you're treating a patient with cancer, with chemotherapy. Okay, so these lead to depression. So when you're using corticosteroids, all these things that inhibit your immune system, okay, so that you don't have an inflammation response. All of these things then can play in to create and cause depression. So if your body is acting in an inflammatory response because you have allergies, they're constantly inflamed. Your body is telling you things are going on. It's going to develop over time. Your nervous system, your immune system, it's going to negatively affect. It's going to make changes. Your neurotransmitters are going to change. Your peptides are going to change. It's going to create stresses, okay? It's going to change your serotonin receptor sites. It's going to make changes. At the top of 160, you have some reactions to acute prolonged chronic stress that's in table 10.1. Take a look at those components there. So we try to mediate as much as possible our stressors, okay, and try to manage them. And that's part of what this chapter is all about, and how we manage them. Okay, so stressors, physical, psychological. Remember, perception is a good part of how we perceive our stressors. This is all on page 160. Your individual temperament. Remember, you're born with your temperament, okay? Your childhood experiences, your vulnerability, your genetic structure, your experiences, your coping strategies, your personal outlook on life. These all provide your strength, your social support, your support groups, your culture, your spiritual and religious beliefs, all mitigate your stress response and how you're going to handle it, how it's going to impact you. Okay? So what reaction to stress is healthy? Distress, eustress, stressors, none of the above. If you said eustress, you've got it. You need to put eustress in your life. It is one of your wonderful coping mechanisms that you want to have is eustress. Nursing management of stress response. So one of the things that people need to do is do a self-evaluation. And one of them is called a life questionnaire or a recent life changes questionnaire. Identify holistic approaches to stress management. Teach a classmate or a peer how to do a relaxation technique to help lower your stress activities. Explain cognitive techniques to help increase a person's tolerance for a stress event. We'll do a couple exercises in class. So, measuring stress. So, how are we doing this? A social readjustment rating scale, HOMES, measures the level of positive and negative stressful life events over a year or a recent life changes questionnaire. You have in your book on page 163, um, table 10.3 is a questionnaire where you run through and circle all the things that have changed or issues that happen in your current life. Okay, and you circle these things and you tally them all up, and based on the tally of this questionnaire you then can evaluate where you fall in your stresses of your life over a 1 year period of time. There's many types and different types of questionnaires. You also have a resource in your book under your tools that you can do this questionnaire. I have put a stress busting one that is in your clinical forms that you can do as a self-evaluation. And you'll see that some of them are positives, like going to college, going to nursing school. Those aren't necessarily bad or good, they're stressors. And when you're adding these up, you start to look at what these things are and aren't. And when you're over a certain level, you need to take a look at how you're balancing your life in your stress management and making sure that you're putting in enough coping mechanisms to manage your stress life, so that you're not exhausting yourself. Okay, so basically if you have a score of over 300 or over 500 in a year, you are maxed out. You need to look at balancing things a little bit more, see what you can take off your plate a little bit. If you're under 300 in a year, that you're doing pretty good. So it just kind of gives you a little perspective of where your life stresses are at. So, assessing 4 coping styles: health sustaining habits, life satisfaction, social support, and effective health responses to stress. So what kind of things do you have that are habits, daily living kind of things that you do to sustain a healthy lifestyle? You know, this is things like exercise, your diet, your sleeping habits, the things you do to relax, your medical compliance, like taking your medication, following up with your doctor's appointments, the things that you sustain your health. What about your life satisfaction with your family, your work, your hobbies, your humor, your spiritual? What about your social support, your network? Are you hanging out with your friends, or are you isolating? Effective and healthy responses to stress. How are you handling your stress? Are you isolating all the time? Are you crying? Are you yelling and screaming? How are you managing those stresses? So as Maggie continues to develop ways to manage stress in her life, she works at developing 4 coping styles as much as possible. Already, the yoga class and lunch with her daughter has become an effective, healthy response to stress that has also health sustaining. In the area of social support, she relies not just on her sister, but on a group of single parent students she finds on campus who meet and share things that work for them. So she is doing the health sustaining components, okay? Life satisfaction, she's got a support group starting to work, and she's working on that effective health response components. Okay. So managing stress through relaxation techniques. So we've got biofeedback. Now what biofeedback is all about is hooking yourself up to a machine to work on relaxing yourself by monitoring your respirations, your blood pressure, your pulse, your temperature. So you learn how to increase your body's temperature through relaxation techniques, and you physically can see the change in your body temperature, or decreasing your blood pressure, or decreasing your pulse, but you're using an actual machine to see that change taking place. Deep breathing exercises, where you learn how to use your abdominal muscles to breathe in through your nose, out through your mouth, in long, slow, deep breaths, holding between the inspiration and expiration breathing. Guided imagery, using visual imagery to seek a place of peace. Progressive relaxation is where you're tensing and relaxing muscles. Meditation and mindfulness, that is where you're putting yourself in the moment, and you can use an exercise that is on page 10 or page 167. One of the mindful techniques is called stop, where you stop what you're doing and put things down for a minute. You take a breath and breathe in through your nose, out through your mouth. And some people do in through your nose and out through your nose, but usually it's in through your nose, out through your mouth. Okay. You observe your thoughts, your feelings, and your emotions, and you reflect on them for that moment, and you proceed into the moment, and you take and talk with a friend and appreciate where you're at this moment. A lot of mindfulness, right, we use is to have the person stare at something that's in the room, notice the smell, the color, and touch and feel what's in that second of that moment, because usually a lot of times someone may be starting to panic and they need to do what we call grounding. They ground themselves to this place and time to realize that they're not where they think they are, but where they're really at this moment of time. Grounding. So other relaxation techniques, or otherwise we also call them effective stress busting techniques, is physical exercise, journaling, humor, cognitive reframing, reducing caffeine or stopping the intake of caffeine, using a pet, massages, sleeping. These are all things that can be done to help decrease stress levels. And with cognitive techniques that we talk about, cognitive reframing, one of the things that happens is what you're doing is reframing things and looking at them in a more positive light. From this experience, what did I learn? What would I do differently? So we're reframing what we're seeing. So here's the question. In gas, what stage occurs first? Alarm, resistance, or exhaustion? A, alarm, that flight or fight response.